Meet CRAN, a team of data science students from RMIT University. We love to solve challenges that contribute for betterment of the society. Now, we are working on a solution that may help public health officials and epidemiologists in their effort to combat COVID-19 virus spread. COVID-19 has adversely impacted millions of people around the world. As of September 2020, the disease has infected around 32.7 million people, including 6.7 million in the United States, which is currently the highest number in the world. As a response to this pandemic, currently in the United States, at least 3 companies have advanced to late-stage testing for potential COVID-19 vaccines. Most experts think that there is a likelihood that COVID-19 vaccines will have limited supply initially. Government agencies, including public health officials, need to answer some critical questions such as who will get the vaccine first and why. In the reference to 2009 H1N1 pandemic, WHO issued recommendation on vaccination priority of the target groups. However, there is still a question on which local area within a country should be considered having higher priority. One possible approach is to follow a proposed novel framework in which clusters of local area are identified based on their epidemiological characteristics. Data of these clusters are then made as an input to an infectious disease model to observe the dynamics of overall cases if people within these clusters are vaccinated. Finally, after iterating multiple combinations of clusters, it can be determined which vaccinated clusters would give the most desirable output. As a case study, CRAN selected United States where there are more than 3,000 counties. Using agglomerative hierarchical clustering technique, it groups together the counties based on active cases per 1,000 people, population density, and 14 days average of new cases. The identified clusters are then simulated using SIR epidemiological model, which is considered having reasonable predictive power for infectious disease that transmit between humans. The S, I, and R are calculated using ODE, taking the number of population and epidemiological parameters as the input. To model the vaccine intervention, the formula was slightly modified to include vaccination-related parameters. Given the novelty of this framework, is there a way to measure its performance in comparison with the currently used technique prior to vaccine deployment? In the future, there are opportunities for further improvements such as dataset enrichment to include non-vaccine mitigation measures, adoption of epidemiological model that has better performance for COVID-19 pandemic, and customization of application for use by other countries.